Good afternoon, my name is Professor Fred Witjes. I'm an oncological urologist. I'm a urologist, but I do oncology in the Netherlands, in Nijmegen, in the Radboud University Medical Center. What I didn't tell in the beginning, I'm chairman of the muscle-invasive bladder cancer guideline of the EAU already for some years, and I've seen the development in, or let's say not the development, but the interest in trimodality treatment growing year by year. It actually, if you want to do bladder preservation, you shouldn't do only TOR, you shouldn't do only chemotherapy, you shouldn't do only radiotherapy, but the combination of those three, a good TOR and chemoradiation, so the combination of radiation therapy and the low dose of chemotherapy. Chemotherapy then is a radiosensitizer. It's not really used to kill the tumor, but to sensitize the radiotherapy, gives very good results. And I think, although I'm a surgeon, so I am biased, but I think if you do a very good patient selection, patients might do as well with radiochemotherapy, which means bladder preservation versus radical cystectomy. Having said that, if you look at the in and exclusion criteria for those patients, it's the minority of patients that are fit or good candidates for chemoradiation. That will be, let's say, maybe 1 in 5, 1 in 6 patients, because you shouldn't have CIS, you shouldn't have a big tumor, you shouldn't have hydronephrosis. So there are a lot of patients that are unfit for that strategy, but if you're fit for that strategy, it's certainly something that I discuss with my patients as an alternative for radical cystectomy. The answer is simple, I really don't know. If you look at the immunotherapy developments in bladder cancer, it's coming from melanoma, lung cancer, now bladder cancer. Second line, it's effective because we didn't have any second line in bladder cancer. First line, it's now been approved after chemotherapy in case of patients that do not have progressive disease. It does improve progression-free survival. After surgery, there is a large study that has also shown that there is an improved progression-free survival if you still have tumor and you get immunotherapy. So in the, let's say, more advanced stages, immunotherapy certainly has a role in case of bladder cancer.